did not cause an emergence of asthma symptoms. The Garcia-Marcos study determined that a consistent protective effect against childhood asthma resulted from the consumption of nuts, seafood, fruit, vegetables, and margarine. Forestier study found that regular citrus fruit consumption and kiwi fruit consumption caused a highly significant protective factor against asthma symptoms in children. And the Davital study found that a high intake of vegetables, fruits, nuts, legumes, fish, and cereal were associated with less asthma and wheezing. For the experimental studies, the Husseini study assigned children to a high fruit and vegetable diet for a period of 6 months. The group that consumed the high amount of fruits and vegetables had significantly few subjects with 2 or more asthma exacerbation episodes, indicating that a high carotenoid plasma levels may contribute to the protective factor that fruits and vegetables had on reducing asthma exacerbations. The Papa Michael study required that participants consume 2 fatty fish meals per week of at least 150 grams of cooked fish for 6 months. It was found that children who consumed this amount of fish per week as an adherence to the Mediterranean diet pattern had a decrease in bronchial inflammation by at least 14 units, indicating that positive association between the Mediterranean diet and asthma. The Papa Michael study also examined vitamin D status in relation to pulmonary function and airway flow. It was determined that a high prevalence of vitamin D levels through fatty fish intake enhanced ventilatory function among asthmatic children. Lastly, the Calteude-Siaz study examined the effects of consuming high amounts of food within the Mediterranean diet over a period of 8 years. Participants were required to consume a high amount of food within the Mediterranean diet from 2011 to 2018. It was found that the children had asthma symptoms that were decreased after 3 to 4 weeks of following the Mediterranean diet. So after analyzing the studies within this review, it was evident that consuming the Mediterranean diet for 3 or more days a week is associated with reduced asthma symptoms among children ranging from ages 4 to 8 years old. Indications of specific vitamins such as vitamin D, E, C, and carotenoids were found to have some effect on the decreased prevalence of asthma symptoms. However, due to the fact that these are not the main focus of the studies, it was difficult to determine a strong or weak correlation between the specific vitamins and asthma symptoms. So for the strengths and limitations, the results of this review could help to enhance the lives of children who suffer from asthma and asthma symptoms. It could also help to determine a more concrete solution to the prevention of asthma and reduction of asthma symptoms among children. 8 out of the 15 studies used a food frequency questionnaire to measure either specific foods or food groups, and 13 out of the 15 studies utilized a food frequency questionnaire to help determine the relationship between Mediterranean diet and asthma symptoms among children. For limitations, the food recall intake from the questionnaires provided to parents may have been biased and affected the results of the study. One study did not include a precise Mediterranean diet, instead examined the effects of sugar-sweetened beverages on the asthma symptoms, which does relate to the Mediterranean diet. However, this was not a food. And not all studies included a specific measurement for frequency of the diet consumption, but used a range of days instead. So for implications for research and practice, research could be completed to determine the exact number of days needed to consume the Mediterranean diet to see reduced asthma symptoms. Cereals, vegetables, and fruits were found to be the most effective in reducing asthma symptoms, which could be used for future research to measure how much of each item needs to be consumed to reduce the asthma symptoms. Healthcare professionals should recommend that the Mediterranean diet to children who suffer from severe asthma symptoms as a way to help reduce the asthma symptoms. Healthcare professionals should also recommend an increase in cereal, fruit, and vegetable consumption to those who suffer from asthma. And these are my references. Thank you for watching.